Welcome to our comprehensive guide on OET writing for nursing. Today, we will analyze a model letter that achieves a score of 350 plus. Before we dive into the letter, let's review the case note summary for our patient, Mr. Joseph Camilleri. The patient is a 72-year-old male, admitted on May 10, 2026, with an exacerbation of chronic obstructive pulmonary disease. Following treatment, he is scheduled for discharge today, May 21st. It's important to note his medical and social context. Mr. Camilleri lives alone and will require ongoing home oxygen therapy, making community support essential. He has a significant 40-year smoking history. While he has completed inpatient physiotherapy, he still requires diligent follow-up. Now, let's examine the model letter itself, written in a professional and concise tone. This letter is addressed to the community nurse. Dated May 21, 2026, the letter is addressed to the community nurse at the Mosta Health Center in Mosta. The letter begins with a clear salutation and a patient identification line, including the date of birth for accuracy. The purpose is stated immediately. I'm writing to request ongoing community support for Mr. Joseph Camilleri. The writer continues by detailing the admission. Mr. Camilleri was admitted on May 10th with worsening shortness of breath and reduced oxygen saturation. His medical history is concisely integrated, noting long-standing COPD and the significant smoking history mentioned in the case notes. During his stay, he received bronchodilator therapy, corticosteroids, and antibiotics, leading to gradual clinical improvement. Moving to his current status, the letter notes he is stable, but remains dependent on low-flow home oxygen therapy. Crucially, it mentions he's mobilizing independently, albeit with mild shortness of breath during exertion. The writer reinforces the need for support because the patient lives alone, which justifies the request for community nursing. Specific requests are made. Could you please monitor his respiratory status, oxygen compliance, and medication adherence? Additional requests include smoking cessation advice and the early identification of any worsening symptoms. The letter concludes professionally, offering further information if required, and signs off as staff nurse. Why does this letter succeed? Let's analyze the 5 key factors that contribute to a high OET score. First, the purpose is clear. The reader knows exactly why the letter is being written from the very first sentence. Second, the organization is logical. It follows a structured flow from introduction to treatment, current condition, and final request. Third, the tone is consistently professional and concise, which is vital for clinical communication. Fourth, the letter uses strong language features and precise clinical terminology that demonstrates high linguistic proficiency. Terms like gradual clinical improvement and medication adherence are excellent examples of appropriate professional vocabulary. Finally, the writer included only relevant information, omitting unnecessary details that could clutter the message. To help you achieve similar results, let's review some high-scoring phrases you can use in your own letters. For your introduction, consider using "I am writing to refer" or "I am writing to request ongoing care for." When describing the current condition, phrases like "the patient has responded well to treatment" are very effective. In your request section, try "Could you please continue monitoring?" or "Your ongoing support would be appreciated." Conversely, there are common pitfalls you must avoid to ensure your score doesn't suffer. Avoid copying case notes directly and refrain from including irrelevant details that don't help the recipient. Never use informal language and ensure your paragraphing is clear to maintain the logical flow of information. Finally, watch out for grammar mistakes and never forget to include a clear purpose statement in your introduction. By following these principles and studying the model letter, you can master the OET nursing writing task. Remember, the key to a high score is clarity. Practice writing concisely while ensuring all clinical imperatives are met. Always keep the recipient in mind. Ask yourself, what does the community nurse need to know to provide the best care? Grammar and punctuation are the foundations of your score. spend time reviewing the basics of medical letter formatting. We hope this analysis has been helpful. Good luck on your journey to becoming a certified healthcare professional. For the best results, practice writing daily using official OET materials and seek feedback from clinical communication experts to refine your style further. Thank you for watching. We are here to support your professional growth every step of the way. Farewell for now.